Hello everyone. This video clip introduces lateral view of skull. The skull, viewed from the side or laterally, may be divided arbitrarily into cranial and facial portion by line extending between the lateral projection of frontonasal suture here and mastoid process. The tip of mastoid process like this. This is a very arbitrary and rough concept. Some textbooks like Gray's Anatomy are subdividing the skull into three zones: face, temporal region, and occipital region. That means anterior, medial, and posterior. In this case, the face has been considered in the section on the anterior view of the skull. Anyway, in this video clip, we will adopt the former concept. The cranial part. Here, we ought to understand 12 anatomic structures in the cranial part. First, I will show you the name of the 12 structures. First, the temporal line, temporal fossa, external acoustic meatus. Number 4, styloid process. Number 5, mastoid process. Number 6, suprameatal triangle. Number 7, mandibular fossa. Number 8, articular tubercle. Number 9, articular eminence. Number 10, postglenoid process. Number 11, zygomatic arch. Number 12, zygomatic process of temporal bone. In this figure, number one is like this. Number 1. Number 2, temporal fossa is here. Number 3, external acoustic meatus is here. Number 4, styloid process is here. Number 5, mastoid process is here. Number 6, suprameatal triangle probably located here. Number 7, mandibular fossa is here. Number 8, articular tubercle here. Articular eminence is also located here inside of the articular tubercle. Number 9, articular eminence. Number 10, postglenoid process located here. Number 11, zygomatic arch is here. Number 12, zygomatic process of temporal bone is the part of the zygomatic arch in some part around here. Okay, now I will describe these structures in detail from now on. structure I will talk about is the temporal line. There is either of two nearly parallel ridges or lines in each side of the skull having the name of the temporal line. These lines begins as a single ridge on the temporal bone around here, run upward and backward from the zygomatic process. This is a zygomatic process. Above the temporal fossa, divided into superior temporal line and inferior temporal line, and continue on the parietal bone like this. Superior and inferior temporal lines like this. The temporal lines often present anteriorly as distinct ridge, but becomes much less prominent as they arch posteriorly across the parietal bone. This is a parietal bone, and this is a temporal bone, green color, and this is a frontal bone. Okay, the inferior temporal line becomes more prominent. It means that the around here is very prominent. As it curves down to the posterior part of the squamous part of temporal bone. This is a squamous part of temporal bone. Forming a supramastoid crest around here at the base of the mastoid process. As you know, this is the mastoid process of temporal bone. The superior temporal lines where the temporal fascia attach. This is a superior temporal line. Where the temporal fascia attach. Temporal fascia is the fascia of the temporal muscle, and the inferior temporal line is the site of attachment of temporal muscle. Here, the temporal muscle attach. Okay. Structure I will talk about is the temporal fossa. This fossa is a shallow and wide depression on temporal region and one of the largest landmarks on the skull. Here, the temporal bone, the sphenoid bone, and parietal bone and frontal bone. Temporal bone, parietal bone, frontal bone, and sphenoid bone's greater wing contribute to its concave wall. It is superior to the infratemporal fossa. The infratemporal fossa is below and is deep to the zygomatic arch. As you can see in this figure, the infratemporal fossa cannot be seen well, actually, which lies beneath the zygomatic arch. The floor of the temporal fossa is formed by 4 bones usually, but sometimes including the zygomatic bones here. The frontal and parietal bones superiorly. These 2 bones are located superiorly, and the greater wing of sphenoid bone and the squamous part of the temporal bones are located inferiorly. All 4 bones of one side meet at a roughly H-shaped sutural junction termed terion. This is the terion, and this point is very diverse and different among individuals. This is an important anthropometric landmark because it commonly overlies both the anterior branch of the middle meningeal artery, which will be discussed in the blood vessels of the head and neck in other parts of this head and neck anatomy, and the lateral fissure of the cerebral hemisphere. Trauma in this region can lead to an extradural hematoma, which can result in herniation of the brain tissue and ischemia. The terion corresponds to the site of the anterolateral fontanelle of the neonatal skull, which closes in the third month after birth. In our textbooks, the boundaries of this fossa are explained as follows. Medial. Medial means in this figure is the deep and the far from your side. The frontal bone, parietal bone, temporal bone, and zygomatic bone and sphenoid bone. In other words, is the base or the floor of the temporal fossa. And the lateral means the temporal fascia is the to your side and the boundary or limitation of this temporal fossa is demarcated by the temporal fascia. The anterior, posterior surface of the frontal process of zygomatic bone. This is the frontal process of the zygomatic bone anteriorly, and the posterior surface of the zygomatic process of frontal bone. This is the zygomatic process of the frontal bone and process. So it means that this line is the anterior border of the temporal fossa, and the superior is a pair of temporal lines. It means that two temporal lines, the superior temporal line and inferior temporal lines, that arch across the skull from the zygomatic process of the frontal bone to the supramastoid crest of temporal bone. So this area is the zygomatic process of frontal bone, and the supramastoid crest of temporal bone is here. Inferior is the zygomatic arch laterally to your side, and by the infratemporal crest of the greater wing of sphenoid bone medially, probably around here. The contents of this fossa are temporal muscle, anterior and posterior deep temporal artery and vein, superficial temporal artery, and zygomatico-temporal nerve. And temporal fossa communicates with the infratemporal fossa inferiorly, orbit and face anteriorly by zygomatic canal, and orbit anterior inferiorly by inferior orbital fissure. So I will write down the contents of this temporal fossa. Anterior and posterior deep temporal artery and vein. In fact, the anterior and posterior deep temporal artery is the branch of the maxillary artery, especially the second part, and the superficial temporal artery, a kind of terminal branch of the external carotid artery, and zygomatico-temporal nerve. And most importantly, this fossa accommodate the temporal muscle. And the communication. Communication with infratemporal fossa. Inferior direction, and communicate with orbit and face. Anterior direction via zygomatic canal, and orbit anterior inferiorly by very important structure inferior orbital fissure, which we discussed in the former session, and the orbit. The next is the external acoustic meatus. In this figure, it is located around here. The external acoustic meatus is formed and surrounded by the tympanic part of the temporal bone. It is a bony canal for ear canal, a tube running from the outer ear to the middle ear. The adult human ear canal extends from the pinna to the eardrum and is about 3 cm in length and 0.7 cm in diameter. The external acoustic opening is the opening of the osseous part of the external acoustic meatus, visible on the skull. Thus, in this lateral view of skull, the explanation about external acoustic meatus was generally about the external acoustic opening when speaking strictly.